Hereby, I open this academic ceremony in which Stephanie Ashton will defend the academic thesis Can't Get You Out of My Head, Impairing and Improving Suppression of Unwanted Memories. May I invite you to present a summary of your thesis and your conclusions?
Thank you very much. Dear Pro-Rector, dear members of the Defence Committee, dear supervisors, dear friends, family and colleagues here today and also watching online. I will start today by summarising the last 4 years of work that have gone into making the thesis Can't Get You Out of My Head, Impairing and Improving Suppression of Unwanted Memories. Now, when you heard the phrase can't get you out of my head, perhaps something immediately popped into your mind. Perhaps it's a thought or a person you were struggling to let go of. Perhaps it's something you're worried about of the future, or perhaps it's just an annoying thought that you can't get out of your head, but you really want to. Well, to some extent, we have control over these unwanted thoughts via an intentional act known as suppression. The goal of this thesis was to look at factors that can impair or improve this ability. Unwanted thoughts can come in many forms. They could be bad memories of the past, things you fear or worry about for the future, or thoughts that distract your attention away from your current goals. The role of suppression is to help prevent or push out these unwanted thoughts when they do come to our mind. Now, these may come to our mind through a reminder from our environment. In this example, I have shattered glass. You may see this shattered glass on the floor at a bus stop in a window, but by itself, it's simply shattered glass. However, for you, this means something more, and for you, this triggers another association you have and reminds you of a car accident you were once involved in. The role of suppression is to help loosen this association so that when you're presented with a reminder, that memory doesn't come to mind as easily. There are two main goals of suppression. One is to reduce intrusive thinking, and intrusion in this context would be a thought that comes to mind unwillingly or involuntarily. And the second is to impair and forget parts of that memory. So if you're good at suppression, if you have a high functioning in this ability, it helps you to regulate your emotions, not to dwell on negativity or thoughts that would otherwise potentially make you feel bad. So how do we test this in the lab? How do we test this experimentally? We use something called the think, no think task, and it's made up of 3 main parts. In the first part, participants learn pairs of stimuli. So I have word pairs in this example. And they learn multiple pairs so that when we show them the first word, they can tell us what word went with it. Then in the second part, they're shown a selection of words they've just learned, not all of them, but some, and they're tasked to do one of 2 things. They're either shown the first word in green, and they're asked to actively think of the word that went with it, or they're asked to do the opposite. They're shown the first word in red, and they're asked to actively push out any thoughts of the word that went with it. And they do this repeatedly for multiple words. If the thought does come to mind for the red words, despite their efforts to suppress it, this is classed as a memory intrusion. And this is one of the measures we look at. So the better you are at suppression, the less intrusions you would have. Then in the third and final part, they're shown all words they learned originally, and they have to tell us all words that went with it. And the general finding is that participants remember fewer of the red words compared to words they've practiced for the green condition or words they haven't seen since the learning phase, which was knee snow in this example. And that's the effect we want to see. This shows that suppression leads to forgetting. You've actively suppressed these red words over and over again, and it's impaired the memory trace. So the better you are at suppression, the more of these red words you would have forgotten. To give an overview of what I will discuss today, I will discuss 4 experimental chapters of the thesis. The first goal was to look at impairing suppression, covered in chapters 2, 3, and 4. And lastly, we wanted to know, is there anything we can do to make it better? So in the last chapter, chapter 5, we look at improving suppression. So for impairing suppression, we were first interested in where it goes wrong. Deficits in suppression are observed in several psychological disorders. They can be seen in flashbacks in PTSD, rumination in depression, or worries in anxiety. Now, a key factor that these disorders have in common is the experience of stress. Stress may contribute to the onset of these disorders. It may also contribute to the maintenance of the symptoms experienced by these individuals. Not only can stress have a negative impact on our mental health, it can also affect our cognitive functioning, our brain functioning as well, including the ability to inhibit information. Now, inhibition is key for us to be able to suppress memories. If we want to suppress something, our brain sends out this stop signal, which prevents the memory from being retrieved. So if stress can affect our ability to inhibit, in theory, it could also affect our ability to suppress memories. In order to know if stress could affect our ability to suppress, we need to know what happens to our body when we're exposed to a stressor. And our body deals with this through two main mechanisms. The first is our fast-acting response. This is driven by our autonomic nervous system, and this puts us into our fight or flight mode, ready for action. And this results in the release of noradrenaline. Now, noradrenaline results in several symptoms like sweating, dilated pupils, increased heart rate, and increased blood pressure. We also have a slower acting response. This is a regulatory system known as our HPA axis, and this results in the release of the hormone cortisol. Now, what cortisol does, it provides our body with energy and helps reallocate our body's resources to deal with a stressor over a longer period of time. And in the lab, we look at this with saliva samples. So how do we look at acute stress in the lab? We use something called the Maastricht acute stress test, and it's made up of two alternating parts. In the first part, we have a physical stressor where participants put their hand in an ice bath of around 2-degree water, very cold water, and they alternate this between doing a social stressor. Now here they have to perform some difficult mental arithmetic on the spot, out loud, whilst being videotaped and whilst receiving negative feedback from the experimenter. So it's not a very nice test. And what many studies before us have found, and also all studies of the thesis, it increases blood pressure, increases cortisol, and induces a subjective feeling of stress. So participants also report that they feel stressed when doing this test. So to look at impairing suppression in the first 3 chapters, Chapter 2 behaviourally tested whether stress impairs suppression, and Chapters 3 and 4 wanted to look more into the stress response, so investigate which physiological aspects of the stress response contribute to these impairments. In Chapter 2, to see whether stress impairs suppression, we recruited 100 healthy participants. 50 underwent the stressor, and 50 did a control task where they put their hand in warm water instead and do simple counting tasks, so no stress in comparison to the other. And we asked participants to come up with descriptions of fears they imagine for their future. And we asked them to come up with 2 words that can act as reminders for them. The first word, the hint word, should be an obvious reminder that links back to this description. Here it's car. And the second word, code word, should be something more subtle. So when they put themselves into this imagination, what's a significant detail for them? So I have the car glass example here. And what we found was stressed participants reported more intrusions than unstressed participants, and only unstressed participants showed a forgetting effect. So unstressed participants could forget these red words. Stressed participants were not able to do that. So these 2 results combined suggest that stress does impair suppression. For Chapter 3, now we know stress impairs suppression. We wanted to know what about stress does this, and we started by looking at the role of cortisol. Now, we know from previous studies, including our own, that approximately a third of participants don't show an increase in cortisol when they're exposed to this stressor. So if you design your study right, it can give you 3 groups to look at instead. We had 81 participants, and the 3 groups we had were stressed participants who showed a rise in cortisol. We call these cortisol responders. Stressed participants who didn't show a rise in cortisol non-responders, and we compare this to this no-stress warm water condition. So cortisol non-responders, despite being exposed to this same stressor, show the same cortisol levels as unstressed participants. That's the only way they differ. Cortisol responders and non-responders have similar blood pressure, similar subjective response, so it's really only the cortisol that separates them. And what we found was, again, a stress-induced impairment. However, this time we observed it only in cortisol responders. Cortisol non-responders showed the same forgetting effect as unstressed participants. So what this would suggest to us is, in order for there to be a stress-induced impairment, there needs to be a reaction of cortisol there. In the final chapter looking at stress, we looked at the combined and independent role of stress hormones. So we wanted to know now, is it only cortisol, or could there also be a role of noradrenaline, which comes from our fast-acting response? In order to look at them independently, participants underwent a drug manipulation to block either of the 2 stress systems. So we had 181 participants, and they were either given a drug to block the noradrenergic response, a drug to block the rise of cortisol, and we compared this to a placebo group. So placebo would have had both cortisol and noradrenaline in their reaction. And as before, we compared this to a no-stress condition. And what we predicted was, well, if cortisol is driving this impairment, then surely blocking it with a drug should also block this stress-induced impairment. That's what we expected to find. However, we found no group differences in intrusions and no group differences in forgetting. So whether they'd been exposed to a stressor or not, drug or no drug, everyone performed very similarly across the task. So we didn't find support for our prediction there. We also didn't replicate the findings of the first 2 studies, and we have some ideas as to why this may be. In chapters 2 and 3, learning and suppression were performed on the same day, just one after the other. And in chapter 4, we performed them across 2 separate days. So they did the learning on day 1, came back to do the rest on day 2. And we know an overnight sleep helps to strengthen your memories. So it could be that stronger memories become more resistant to change, and that's why we don't find a difference there. To go back to the overview, we've covered impairing suppression in the first 3 chapters, and now we will conclude by looking at improving suppression in chapter 5. For improving suppression, we looked at mindfulness as a candidate. Now, mindfulness is our ability to stay focused and aware in the present moment, and it has many well-known benefits, including increasing positivity and well-being, reducing feelings of stress, and improving focus. As well as these well-known psychological benefits of mindfulness, research has also shown it can induce cognitive changes in our brain as well, including the ability to inhibit information. Now, inhibition is this process we need to be able to suppress memories. So we thought, okay, if mindfulness can improve our ability to inhibit, can we apply this to suppression? Can we apply this to memories? To look at improving suppression with mindfulness, we had 148 participants who underwent a 10-day app-based intervention for 5 minutes per day. And they were allocated into one of 2 groups. The first group did a mindfulness training program, and the other group, our active control task, listened to podcasts instead, delivered by the same app. The key difference between the 2 was one were actively practicing the techniques, the others were more passively listening to the benefits of mindfulness more in general. So this acted as our placebo group. At least we'd hoped it would, however. Both groups increased in self-reported mindfulness, which is not what we'd predicted or hoped, actually. We'd hoped only the mindfulness training group would improve, and then we could compare it to the control group, compare suppression between the 2. But as everyone was just as mindful as one another, we looked at everyone together, and we found that greater mindfulness resulted in fewer intrusions, and it enhanced the ability to suppress. So normally for these red trials, the first few times you see them, it's really difficult. You can't break that association. So it takes you a good few attempts to get used to it. People who were higher in mindfulness did this quicker. They were quicker to pick up the task, quicker to have less intrusions. To conclude the thesis, for impairing suppression, we find in chapter 2 that stress participants had more intrusions. In chapters 2 and 3, we find that stress impairs motivated forgetting. And in chapter 4, we found no effect of stress. So what this would suggest to us is it doesn't apply to all types of memories. For improving suppression, in chapter 5, we find higher mindfulness results in fewer intrusions, and it may help us to learn suppression more easily as well. For implications of the thesis, what we can take away from this is we now have key insights into mechanisms that may impair our ability to suppress, and we've identified avenues for potential therapies for individuals experiencing intrusive thoughts. And lastly, thank you to all co-authors on the papers. Thank you to my supervisors, everyone here today. I give the word back to the Pro-Rector.
Thank you very much for a very clear presentation. The opposition will now be opened by Professor Blokland, who is a professor in comparative neuroscience at this university.
Thank you, Pro-Rector. Dear candidate, first of all, my congratulations for finishing this thesis and presenting and giving a nice overview of the contents of the thesis. Of course, I would like to congratulate your promotion team. And of course, I think I have to congratulate one members of the audience for a great cover. And yeah, so it's an interesting set of studies. But of course, I really like the combination of behavior and biology, because that's what I also like to do. But it seems quite difficult. I don't think it's always that easy to interpret the relation between biology and behavior. And I would like to take you to chapter 3, where you make a distinction between the cortisol responders and the non-responders, based on the cortisol level, as you just explained in your presentation. But when I look at table 1 on page 69, when I look at the subjective stress, it looks like there is no difference between the cortisol response and non-responders, or the negative effect. And also when you look at the physiological measures, I don't see a difference between the 2 groups, not that clearly at least. So, but there's only the difference between the cortisol. So my first question is, so what causes this difference in the cortisol response, whereas they report the same negative effect, so they feel like stressed?
Yeah.
But there's something like a cortisol response that differentiates between the groups. So
Yes.
I don't get my head around that. I'm not sure whether you have an explanation, because I can't get up with an answer to that, but I would like to have your thoughts on that.
I can, highly esteemed opponent, thank you for your question. I could definitely give it a go, at least. First of all, thank you for your compliments also to my mum in the front row for the cover. So what causes this difference in cortisol reactivity? So yeah, they do show similar subjective responses and similar blood pressure, which is what we want for this kind of experiment, right? If we want to just zoom in on cortisol. Cortisol reactivity, we control for a lot of things that can make the cortisol response differ, like lifestyle choices, weight, sex, age, all kinds of things. But of course, we can't control for everything. So there could be a genetic factor that causes this difference. Cortisol reactivity is driven by our MR and GR receptors in the brain, their distribution and and how they react. So of course we can't control for that, but that is something known. Our responders rate is also in line with other studies as well. We actually have some lower than other studies. If we were to do the CPT, so just the cold pressor test instead, you can get around 50 of these non-responders. So if you combine it with a social stressor, it seems to increase that a little bit. But it seems to be a genetic component there.
Well, good that you mentioned that there are various potential factors that could dissociate these two. So when I look at the data then on page 71, when I look at the data, figure A, so when you look at the suppression of the memory, unwanted memory, then I mean, I wonder, so this is CIF index, I don't really have the number of items that they are able to suppress. So I wonder, what does it really mean? You find statistical reliable difference, but I really wonder what it really means, this difference. Is it meaningful to have, like it goes from maybe 0.05 to minus 0.05. So what does it really mean? And is it meaningful as such?
First of all, how the CIF index is calculated. So I realize on a graph it looks like a very small scale. It's also because we baseline correct for them as well. So it has quite a small axis on that. What does it mean? So we do find small effects, of course. We find them in this chapter, and it's also consistent with the literature. So I think it's just really a small effect. Okay,
yeah. But nicely, what you show, of course, in the B figure there, so I really had a close look at it, and I didn't have the PDF to zoom out and to have a close look. But for me, so you did the correlation analysis, so you correlated all participants of all groups, all three different groups, and you calculate the correlation. And for me, a correlation of 0.24, I think it was something like that. It was statistical reliable, but but a correlation of minus 0.24 is explanation level is really low. But then I wonder, why would you include the control and the non-responders in this analysis? Why not just, because this is the group that responded to and had less intrusive thoughts, and you would like, and these are the responders to cortisol, so there where I would expect a correlation. And I was not able to differentiate the orange and the red ones. Forgive me for that, but so I couldn't dissociate whether there would be a stronger correlation with the cortisol levels and the CIF index. Did you do a separate analysis for these groups? And did you find differentiation in these correlations?
No, we only did it for the full sample.
Yeah, because when I look at the gray ones, they are all, of course, low in the cortisol, and they spread over the CIF index. So if you would take them away, probably there would be even a stronger correlation. But I don't know. But so maybe that would be something that would be interesting to have a look at. Yeah.
Yeah.
Well, it already has been published, so I mean, yeah. Anyway, but still, I think it would be interesting to have a look at.
Yeah.
And you were mentioning the various factors that could be related to the response to cortisol, yes or no. So one of the factors that you mentioned is sex, and I saw that you also had female and male subjects in your data set. Did you have a look at sex differences?
It is normally something we check for, and we try and get as balanced a sample as possible in order to do this. But I don't think it was exactly 50-50 in this study. It just tends to be hard to recruit a lot of men for these studies in psychology. I'm sure other people have that experience as well. But it is normally something we check for at least. But if it's not key for our research question, we tend not to include it in the results.
Okay. Okay. Then
Given the
I give
time,
the word back to the prorector. Thank you for
thank you very much. So the opposition will be continued by Dr. Justin Hulbert, who works as an associate professor at the Bard College in the USA.
Dear candidate, thank you very much for this wonderful work that you have presented to all of us. I was really impressed by the scope of your work, your ambition, but also the way that you backed it up very systematically, trying to figure out the mechanisms behind terms that have been tossed around for quite a while in the literature. So congratulations. So you were careful to consider whether the mnemonic effect of stress induction was specific to retrieval. For example, you tested whether baseline recall or the retrieval index differed across stress conditions. And you found no evidence of a more generalized impairment, which actually allowed you to draw stronger conclusions about the relationship between stress and suppression, which was really nice. But as you note, stress-induced retrieval changes are well known in the literature. And in your general discussion, you reiterate this, saying that whereas acute stress before encoding is found to enhance learning, acute stress prior to retrieval is generally found to have an impairing effect. So my question is, generally, why do you think that you didn't find broader effects of stress on memory across conditions?
Esteemed opponent, thank you for your question. Yeah, of course, and your compliments as well. Thank you. Yeah, of course, we were interested in the effects of stress on suppression specifically. So that's why we timed the stressor to be before phase 2 instead of phase 3. Our whole logic for looking at stress was knowing how stress affects the brain. So its impairing effects on the prefrontal cortex, specifically the dorsolateral prefrontal cortex. So if our theory was right, then it would be specific to suppressed items, and the behavioral data also backs that up. So that would be my guess as to why it's specific to suppressed. And I think, it would be more obvious if we saw a difference within the baseline items as well.
Yeah. So later on in your dissertation, you suggest it would be interesting to look at later periods of the stress response, perhaps when the prefrontal cortex is reactivated again. And I was wondering, since you are very careful to consider the ecological validity of this work, and including using some novel materials that I think gets closer to real-life events, I was wondering if you had thoughts about whether in this initial set of studies you had focused on the critical period that makes the most sense in terms of when people are experiencing intrusions that might be affecting their lives.
Let me just recap your question a bit.
Yeah.
So we, of course, looked at the early stages of stress. So if we looked at it then during later periods, several hours after, for example, would we find similar things, or is that more relevant, basically?
Exactly. So would it be more relevant to consider periods of time well after an initial stress has occurred? In the moment, if I had experienced a traumatic event or something, I probably would be dealing with the situation on the ground for a while. So those memory intrusions might be expected and perhaps beneficial for a little while. After that, many hours after, perhaps that is what is preventing me from getting back to my daily life.
Yeah, I think that's an interesting idea, and I do think that would also be very relevant. I think we also discussed that more in chapter 4 in the discussion, actually, that we should look at later effects. it'd be interesting to what we find. I think we'd find probably more of an effect on the intrusions. That's what I also argue to be more relevant quite often in the thesis. And as we know, for consolidated memories, that tends to have less of a forgetting effect. So we could repeat that experiment, looking at later effects, perhaps doing the stressor on day 1, and then they come back on day 2 to do the rest.
For Chapter 4, speaking of that, you captured the initial anxiety levels surrounding each item on a 5-point scale during phase 2 at the end of the first day, and that allowed you to balance out the conditions. Then on the second day, you provided reminders to participants after they had returned. I was wondering about your reasoning for not recapturing the anxiety levels pre-manipulation on that second day, just to provide a somewhat cleaner comparison, perhaps, to the post-test anxiety measures. I understand why you had to do it on day 1, but could you have done it again?
Now you mention it, yes. Okay. We could have, to be honest. Yeah, we tried to keep it more in line with Chapter 2 and just have a pre and a post score. But yeah, I guess we could have maybe done it where we take a mean of the 2 first measures or something like that as well. But yeah, I have to say I wouldn't expect them to differ much. They haven't undergone any manipulation, so simply writing them on day 1, coming back on day 2, I wouldn't expect to see much of a difference, but that would definitely be a safe option.
And I've lost track of time. Do I still have any time on the clock? Or? You still have some time. Okay. So I was very impressed with your partnership that you formed with Headspace for the meditation study, and I was wondering if you could tell me more about how that process unfolded, specifically whether there were any implications as to your freedom to publish or to share your findings generally.
Yeah, so we worked with Headspace, and they also granted us free access to their app. We could publish what we wanted. We had a contract with them at the start to say, regardless of what we find, if it's not in your favor, we can still go ahead. But they did have to sign off on the manuscript, but they didn't have any say in what we did. They just wanted to see it before it went out. But it was a pretty easy process, yeah. And we wanted to use Headspace because it's so widely used by everyone. So, yeah, a lot of these studies do 3-month retreats and things like that. Great if you have the time. A lot of us don't. So we'd more use an app instead. So, yeah, Headspace seemed like a logical choice at the time.
Wonderful. Well, thank you. I yield back my time.
Thank you very much. Then the opposition will be continued by Professor Schreurs, who is a professor in mechanisms of affective disorders at this university.
Thank you, Mr. Prorector. First of all, dear candidate, my congratulations for your wonderful thesis, and I extend my congratulations to your supervisors. I find this very solid work, which I enjoyed reading a lot. I enjoy the methodological rigor. I enjoy the logical succession of thinking and succession of studies, the lovely writing. So yes, it's like compulsory to say, well, I enjoyed reading it, but in this case it was actually true. I have a few questions for you regarding your central paradigm, this think, no think paradigm, which is kind of on the core of your whole work. If I understand correctly, well, people they do this task, and at some point they get the instruction to suppress, at certain instances, some of these memories. And at the end, you measured and you asked, did you think of them or not? And they report that. But I was wondering, what is actually going on in their minds? Just because you instruct them to suppress, is that what they do? Do you have anything to support that claim?
Highly esteemed opponent, thank you for your compliments. But thrilled you actually enjoyed reading this one, so that's great. Yeah, and I fully understand the question of, okay, yeah, you tell them to suppress, are they actually doing that, basically? Well, we do have quite a rigorous practice task with them. So it's not just, hey, here's some red trials, off you go. We really do train them in what they're supposed to do. After each practice round, discuss their strategy. If they're doing something wrong, we guide them the other way. So
what do they report on what strategy they use? Do you ask them, how did you do this?
Yeah, we do. We say, because we it is difficult, especially if you see it for the first time, like, could I do that? So it tends to be the first practice rounds, they're just not very good at it. And they say, I thought of something else instead, or I looked away, something like that. But we say, yeah, okay, understandable, but that's not the technique we want you to use. We want you to be very specific and push out any thoughts that come their way. Still, how do we know if they're doing that?
It sounds very simple, doesn't it? Because I'm a clinician. I treat people with all kinds of disorders. Amongst of them, people with, let's say, obsessive-compulsive disorders and trauma patients. And they all try to suppress thoughts, and they all fail.
Yeah, I would maybe say it's because they don't have clear instructions for how, or lack of practice. If you just sent me off and said suppress it, I don't know where to start. Okay. So I think it is something that can be trained. But it is something that needs direction and instruction.
So simply train them and they'll be fine.
Well, actually, it's been there's not much research on it, but there's one recent paper that shows that suppression can be trained. They've done it in people's own fears, and it also reduces symptoms of anxiety and depression as well. So that's quite hopeful.
Yeah, you know what? You referred to one of these papers that looked into this specific task in people with psychopathology, mainly post-traumatic stress disorders, and I had a look at it. And what kind of made me skeptic is that the effects they report are quite modest, I have to say, particularly in the patients, and also these studies were done, I think, by mainly the same people. So I think there's not much independent replication, and it's all small groups, and not very large effects. So I have to say, I'm a little bit less confident there than you are. Yeah,
you're not convinced by that meta-analysis, basically.
I'm not.
Okay. I would actually happen to agree with you. The effect size are very modest, they are very small, but for that meta-analysis you're speaking of, that refers only to the forgetting effect. So that's also in line with our studies as well. We also have quite small effect sizes in healthy populations. Okay. What I think is more relevant is the intrusions, as and when these memories come to mind, which I focus on in the second half of the thesis.
It just so happens that my next question was on the intrusions. That's fine. No, very good.
Go ahead.
Thank you for this logical this hint. What is an intrusion? I just looked it up. I listened to your wonderful presentation, and I thought, and is it true that it differs a little bit from what is written in your thesis here? I thought your definition you just gave was broader than what is written here. Here it says, these counterintentional memory retrievals are defined as intrusions. That's quite narrow. Whereas I think the term you used now was broader, I think. So which is it then?
Well, I mean, for this presentation, I'm trying to say things a bit more generally. So I said a thought that comes to mind unwillingly or involuntarily, and if you make that really sciencey, then it would come out as counterintentional memory retrievals.
Yes, but this refers to this specific task, and then these thoughts in the framework of these tasks that people can't push away are then defined as intrusion. And that's a narrow definition that I get. But the same word is used in psychopathology, and I think it's not quite the same thing, because these are words that have been presented quite recently before, and then they come back, and that's like in the framework of a few minutes or hour at the most. Yeah. Whereas, for example, even if you're standing here, just one example, you could have intrusive thought or memory of perhaps, what are these guys wearing beneath their gowns? Yeah, there you have. Now everyone has this intrusive thought. I just invented this on the spot, but these are the kinds of thoughts that patients report to have repeatedly. And I'm thinking, that's the same word, we call that an intrusion, but is that the same thing? And by using this term, aren't you inadvertently linking things that are not exactly the same?
I see a point, which is why I'm very careful to say, in the context of memory control, this is what an intrusion is. But an intrusion has to start somewhere, right? And it starts with something unwillingly coming to mind. And then after, it can have the emotional attachment to it, the emotional reaction. But we're looking at where it really starts, where it really enters your mind. Okay. So, yeah, I think you can use the term for both, but just be clear on exactly what you're referring to.
I agree there. Do I have time, or is...
You have 1 more minute if you have a question.
Okay, briefly then. A quick jump to your mindfulness chapter. I was wondering, why did you expect that mindfulness would suppress, would increase suppression, whereas as far as I'm familiar with mindfulness, the main instruction is accept thoughts and please don't suppress anything. So I found that a bit counterintuitive. Could you briefly say anything about that?
Yeah, I'll try. Sorry, what was the end of the question again? Sorry.
Well, the seemingly counterintuitive instruction.
Yeah, I got it. Yeah. So we picked mindfulness because it's known to improve our ability to inhibit information. So we didn't ask them during the task to practice mindfulness as the technique. They were supposed to have kind of improved something in the background online and then come back to do the task on day 10. If they were like trying to do mindfulness in those trials, I don't think they'd be successful. So it was the process underneath this inhibitory mechanism that we were trying to improve with mindfulness.
Okay, I'm going to rest here because that will take us too far. Thank you very much for your answers.
Thank you very much. Then the opposition will be continued by Dr. Ineke Wessel, who works as an associate professor at the Department of Psychology at the University of Groningen.
Dank u, meneer de prorector. Dear candidates, congratulations. Yeah, I'm repeating what the other opponents already have said. Congratulations on your dissertation. I found it impressive. It contains a series of very thorough and well-designed studies, and it was a pleasure to read. My questions. I have 2 questions, and they concern the underlying mechanism and also the implications for treatment in clinical psychological practice. But let me start with my question about the mechanism. So what are your thoughts about the precise mechanism? So you talk a lot about how something happens in the prefrontal cortex and with the hippocampus, but people they do their best to forget. What happens to that memory, do you think? What does it mean when they don't, recall as much?
Esteemed opponent, thank you for your compliments and your questions. So, looking more into the mechanism, what is inhibition doing? So if we're able to inhibit properly, our DRPFC sends an inhibitory signal to the hippocampus. So my theory, not only mine, is that it temporarily disrupts hippocampal activity. As we see, if we delay the recall, it's not gone forever, but it's temporarily disrupted. So I would say it's kind of chipping away at the memory. It's not a miracle. It's not deleting a whole memory. But I think if you're to do it repeatedly and train it, it can start to impair parts of the memory trace.
Impair the memory trace?
Yeah.
Okay. So something would happen to the memory then? Yeah, sorry, I'm trying to... Yeah.
I'm looking at the reactions and it wasn't good apparently, so go on.
So something would happen to the memory would be impaired?
I think so, yes, at least temporarily.
Okay, yeah, because you also talk about, and I think you just now also talked about how you would impair the association between the cue and the target. And that means that not the target in itself would happen something to it.
Oh, okay, yeah, I see a point like that. Yeah, well, fine, I'm going back on it then. Maybe it's still there, but it's just a weaker association, so that when you're presented with a reminder somewhere, it doesn't come to mind as easily. So it's still there somewhere, but it's weaker.
Yeah, okay, so you're doing something with association. That means that the memory doesn't come to mind that easily. So how would you translate that, for example, because you do that in the discussion, to the treatment of PTSD patients? Because these are people who have those memories, they try to inhibit them. They want nothing more than be able to inhibit them and not think about them. They try the whole day, but they don't succeed. And one of the therapies that is quite successful is imaginary exposure, in which you sort of are invited to retrieve that memory. And you recommend in your discussion to teach them to somehow apply a direct suppression strategy to do something to alleviate their complaints. So how would that, what exactly should they do you think, why would that work?
Well, I think I also say in the general discussion as well that it could be used in a combination. So this kind of exposure imagination therapy you're talking about, we kind of do a similar thing when we use the imagine, no imagine paradigm. We actively put them in there first. They need to be active in order for them to do something with it. This is also this what was the therapy called? Sorry, the
Imaginary exposure.
Imaginary exposure. That is something I imagine that's done with the care of a therapist. Suppression, I think, is a tool that they can take away and use in daily life as and when this memory comes up. So it's something that they can use by themselves, I think.
Yeah, but what would you advise them to do? Because they try to suppress already. That's something that they want to do. They don't want to think about it.
Yeah. I don't really know exactly how they suppress, so maybe if we had more details on exactly what mechanism they were using or what technique they were using, we could give them some more clear indicators of what could be successful and what not.
So what do you think, because you also discuss the use of thought substitution strategies in your discussion.
Yeah.
And that's, of course, something completely different that engages different brain areas even. Mm-hmm. But you could also imagine if it's true for a PTSD patient to have this memory, and there's this, you showed these cues, so there's glass in a car. Yeah. So suppose the glass memory is very specific to that car accident memory. Mm-hmm. You could also say, okay, maybe you should take care of that cue and make it associate with a lot of other memories, so that this car accident memory doesn't come up that often anymore when you see the glass cue. Mm-hmm. So do you see any potential in that to use in...
Yeah, so thought suppression is another strategy that can be used, and they actually have quite similar, at least forgetting effects. The outcome is very similar. You just adopt different mechanisms in the brain to do it. I know that direct suppression is much more widely researched. If I think of the PTSD papers that come to mind, they've used direct suppression. But if it works and the forgetting effect is the same, then I would say that this is another avenue to explore as well. Again, as I've said before, I think the forgetting effect is maybe less relevant, and I don't know of much intrusion research with the thought substitution. So maybe that could be something to explore. I don't think there is any. I don't. Yeah. Well, I see something in the future for you, maybe. Yeah, another grand proposal. Yeah, I'll write it down. Okay. Yes. Well, thank you.
Thank you very much. Then the opposition will be continued by Dr. Shako Sobchak, who works as a professor in dementia, neuropsychiatric symptoms and behavior at Rotterdam University of Applied Sciences, but is also associated to this university.
Thank you, Prorector, and dear candidate. Really would like to congratulate you and your team. For me, it was also a pleasure to read your thesis. I really like your experimental studies, which are very close to clinical practice, but they are not in clinical practice. So I would like to elaborate a little bit more on the previous comments. And I want to make a translational bridge with you to clinical practice. And I have two questions, and if there's some time left, I would like to discuss on a proposition. But when we go to chapter 2, figure 6, page 44, you have a picture on in which you describe the effect of working memory and I would suggest the experience of acute stress and the influence on suppression-induced forgetting. Mm-hmm. And the patients I work with are people with impaired memory functioning. And we know, for example, that especially some subgroups are more prone to develop mental health issues after experience of traumatic events. And I would especially traumatic events in childhood, for example. Okay. So I was wondering, how can you explain this your findings with respect to these subgroups, and what would you like to do to make a resilient future? What should we do with those people with impaired working memory, especially in childhood?
Esteemed opponent, thank you for your question. What was it? I know what the findings are anyway.
6.
So people with lower working memory were more susceptible to the detrimental effects of acute stress on suppression. And of course we find this in healthy controls. So it could be seen more of a risk or vulnerability factor, you know. Perhaps if you have lower working memory, you have that to begin with, and then stress is what tips you over the edge in order to have impairments in suppression, for example. In children, I don't know too much about the research in children. I do know of one study who looked at how suppression develops, and children of 8 to 9 are unable to, but children of 10 to 12 are. So I guess as the prefrontal cortex is developing, they learn these skills. So this may really be, in this early age, a good time to intervene. I know the findings for working memory training are quite mixed. Some people are, there's mixed results showing if it's successful. I'm not sure how the rates are in children. So maybe if this is a vulnerability factor, you could build that up at an early age.
So you would plea for doing this kind of practice in children, for example, to...
Well, perhaps if it's a vulnerable subgroup and it might be, inevitable or likely that they will later develop symptomatology, and to give them some tools to be able to develop that is relevant, I think. But I also think, besides from the working memory, this training study that's come out last year, it's obviously only one study at the moment in healthy adults, but perhaps now I think that there's lots of studies that are going to come off the back of it, I reckon. So perhaps also in children as well.
So when I give a little recap, you would say, for example, especially in vulnerable groups like children or lower IQ, or there are more subgroups with lower working memory capacity, maybe we could invest in training working memory, and that could have an effect on future resilience.
Perhaps. If I'm right that it's a risk factor, a vulnerability factor, then surely training it would reduce that.
Okay, seems interesting. We have some minutes, I guess. Yeah. Then to chapter 5, because you already did an intervention. I was wondering, but we already discussed this a little bit, but I'm working as a psychiatrist in a clinical hospital, and maybe you could join our group, because what would you like to do to translate these findings to our patients? What would you like to do first, or do you need a step in between to make the intervention effective? Or do you want first a research? I really wonder, what do you want to do?
Yeah, and this is in relation to chapter 5.
Yeah, chapter 5.
Well, I do find the results of chapter 5 quite hard at this stage to relate directly to a clinical sample, as of course we did it in healthy participants. If you also look at the results of our moderation analysis, we found that people with low inhibitory control at baseline, as their mindfulness improved, their control intrusions got worse. Which, well, we didn't have a hypothesis for that. We looked at the high inhibitory control. But it's not that promising a research to then directly apply it to PTSD, in people who have low inhibition at baseline already. I don't necessarily think low inhibition in our group represents PTSD. It's low scores on the Stroop in mainly student sample, right? But I don't think this is now the logical study to then immediately repeat it in PTSD.
But what do you want to do then in between, before you go?
What's the next step?
What is the next step? To translate it to clinical practice?
Yeah, I'm going to go back to that training study as well. what I would like to do is, well, now we have a set of experiments that are in a very controlled laboratory setting. For us, it was necessary to be able to look at these variables by themselves. But I think it's time to take it out of the lab and look at memory control in real life. So there's also an intrusion diary study done by Klein in 2013, and they did ecological momentary assessment with PTSD and trauma-exposed individuals, and just monitored how intrusive thoughts were experienced. So I think maybe combining that with a training would potentially be a next step. So an intrusion comes up, here's potentially a tool to deal with it. I think that would be a really cool study. If I do say so myself. But maybe that would first be in healthy participants. I mean, I know we try and relate it to the clinic, but I do think intrusive thoughts are something that's experienced by everyone. So I would do this in potentially a healthy study first, but yeah, maybe clinical populations a bit later down the line.
Okay. Do we have 1 minute?
Yeah, there's time.
Okay, 1 minute. Okay, I want to go to in your thesis. It's number 6. Maybe someone can read it out.
Proposition 6,
Yeah.
forgetting is a function of memory, not a failure.
Okay, you have 1 minute left because I'm not convinced that forgetting actually exists. I don't believe in it. So you have 1 minute to convince me that forgetting exists at all.
Oh, that's a difficult way you've phrased that. Well, yeah, I think forgetting exists. I think we show it in our studies of suppression, even if it's on a temporary basis. I think in your clinic you would also see patients who have complaints of forgetting, cognitive decline with age. I think I've said, negative things about forgetting, that, it's something annoying, something that we don't want to have when we get older. But I also claim that it is a function as well, something protective. I actually took that from Dr. Holbert's paper, looking at the many faces of forgetting. It can be our guardian, our librarian, and our inventor. So it looks after us in many different capacities. I think that was 1 minute.
Okay.
She doesn't look convinced yet, but we'll move on anyways to the final opponent, which is Professor Jelicic, who works at the Clinical Psychological Science Department at the Faculty of Psychology and Neuroscience at this university.
Okay, thank you, dear Pro-Rector. Dear candidate, I also read your thesis with a lot of pleasure. I will tell you why, because at the same time I was reading the first drafts of bachelor theses and a number of bachelor theses. And some of them were quite good, but there were also a number that were really awful. So reading your thesis was really a pleasure in that sense. So congratulations also to your promotion team. Now my question is again about chapter 5, about the study in which you had a bunch of people who either had to do a mindfulness training using a commercial app or listen to podcasts. And when reading your chapter, I noticed that you started with 200 and I have to look it up, 214 participants, and then for multiple reasons you had to exclude more than 60 of them because some of them didn't show up at the final test session, and there were other reasons for excluding them. So my question is, how because these people had to do it at home or not at the university where you could look at them, but they were free to do their mindfulness training, in the cafe or at home or wherever. How do you know that these people complied with your instructions? I also looked up in your chapter how much they earned by doing this, by participating in the study, and they could win 25 euros win, so they didn't get 25 euros, they could win 25 euros, and you know, that is not an awful lot of money so the chances of winning is maybe 1 in 100 or something like that, and then you have to do this 10 times, or on 10 days, 10 different days. So how do you know that these people did what you want them to do? How do you know that? So you excluded over 60 of them, but maybe there should of course you always have people who do whatever they are being asked. But I guess that, you know, if I think back of many years ago when I was a student in Amsterdam, we also had to take part in experiments. We didn't get any money for that. We got credits for that. I was at a certain time I was so fed up with participating in these experiments. So, you know, I think I screwed up a few experiments at that. Well, no, but you get my point. How do you know that these people did what you wanted them to do? How do you know? Because they're not at the university. They're at home, maybe in the cafe, maybe in a bar. You know, you never know. So yeah, so that's my question to you.
Highly esteemed opponent, thank you for first of all, your compliments. I'm thrilled that this was a more exciting read than a bachelor's thesis. That's great to know.
It certainly was.
And your question, so did people actually do what we wanted them to do?
Exactly.
Well, we also gave them a diary to do at the end of each day. So we said, when you're going to get the link to this diary automatically, and when you've done your daily session, please tell us in 3 or more sentences what you just did in your session. And if they missed more than one, they were excluded. So that's why we have quite a high exclusion rate. Is 60? That's really quite a lot.
I think even more than 60.
Yeah, okay,
but
well,
anyways,
yeah, it takes a while, but this was also a registered report. So we pre-register all the criterion. We were very, very strict, and it was also developed by 5 reviewers who wanted all these different things, validly so as well. So that's why we had quite a high exclusion rate on that. It's the same with any subjective data or any online study. How do you actually know what they're doing? We tried to make that as controlled as we could. You know, like they can't just take a diary and go like ... next. You have to write a minimum amount of sentences.
But they have to write
like
3 sentences at minimum, or?
I think it was 3 or more sentences, or
but
3 lines.
The word counted, the number of words didn't matter. So I did my task. It felt okay. Up to the next session. That is.
I see what you mean. I mean, I think if they're bothered enough to open the link in general, they're probably going to fill it out, right? You know, if they're not going to do it, they're just not going to do it. And we see a really high exclusion rate of the people who didn't. Yeah, in terms of the money, I actually think it's all right. The lottery, it's quite standard in something like that. It's also only 5 minutes per day, and they're also getting something out of it. Actually, we show for all the groups, even in the control group, they increase their mindfulness. They get free access to the app. So it's a win-win.
Yeah, but they could have done other things, of course. So if you ask me to participate in a mindfulness study for 10 successive days, or even if it only takes 5 minutes a day, you know, and I would win 25 euros. Of course, my salary is a bit higher than what students get from their parents. But I would, you know, yeah, I would say, well, I'm not sure about this. Also, this is, you know, if I know, you know, my children, they graduated a couple of years ago. If I would ask my son, would you take part in a study, 10 days, mindfulness app, you may win 25 euros. Would you do that? He would probably say, no, you know, why would I do that? But that's maybe, yeah.
Yeah, I understand, yeah. I mean, I won't be recruiting you or your son if we do another mindfulness study. But we advertise it as a mindfulness study. So you're not going to sign, you know, it's not mandatory to sign up. We will have people who do have an interest in it.
But also, did you ask the participants after the second session if they what they thought of the study, whether or not they liked the study, or whether or not they complied with your instructions? There's sort of an exit interview where you, because maybe some of them would say, well, I didn't like it at all. maybe that could then you could also exclude those participants if you did exit interview and just ask participants, okay, did you like the study? Did you comply with the instructions? Do you have some other tips for us for future research? But you didn't do that apparently.
No, we didn't do that. I mean, we do take the diary as kind of our measure of compliance, and for that, it's enough for us. I think if we were like really developing a mindfulness protocol where we wanted to see what works about it, what doesn't, and we were in control of that, then for sure you would have an exit interview asking their experience of it, but it wasn't key for our research question.
You mean not an exit interview was not key for your?
No.
But it's sort of a lot of in a lot of psychology experiments we do that. We do have an exit interview just because sometimes people are deceived by the experimenters or by the researchers, and then you want to know whether or not they knew what the hypothesis was. Of course, that was not the case in your study, I guess.
I mean, I will say that we didn't measure this directly. I mean, once it's a registered report, everything is just set in stone, right? But we did, when we gave participants the debriefing, a lot of participants were like, oh, I was in the control group. Oh, I'm quite surprised by that. So it could have been that perhaps lost my thought.
Okay, thank you.
Stephanie Ashton, the degree committee here present, has assessed... Oh, sorry, I'm totally wrong. Oh, God, yeah. Stephanie Ashton, the time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and your defense. I request that you and your company await the results of our deliberations and our return in this room.
The PhD defense has now ended. The degree committee will debate the candidate's performance behind closed doors. This process usually takes about 10 minutes.
Long road to the south side, 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and die. I know what's on the line. I know you know that I can't read your mind. Years can't fly by now, don't waste all your time. Cause I'll go the extra mile. Long road to the south side, 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, no place like home. If it's questions that you've got, go the extra mile and die. On the dash, got my laces tied. Long road, I don't waste no time. Break rules because fate decides. With the team and we chase the light. I make a move, fall down, shake it off. I hate to lose, bad branch, break it off. No room for negativity, praise and love. Prepare for deep part cause we're taking off. Even though these nights seem long, I know that I am never on my own. Know you won the battle once you grow. South side, 10 miles in my rearview mirror. I know what it felt like. My goals only getting clearer. East side to the west side, No place like home. If it's questions that you've got, go the extra mile and back. Long road to the south side, 10 miles in my rearview mirror. I know what it felt like. My goals will get clearer. East side to the west side. No place like home. If it's questions that you've got, go the extra mile and back.
Can't fly by now, waste all your time. 'Cause I'll go the extra mile.
Stephanie, Ashton, I've practiced this already a little bit. The degree committee here present has assessed the quality of your thesis and your defense. In view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Dr. Anke Sambet is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your supervisor to now take the floor.
All right, please. Someone switch this. Ah, it's on. Wonderful. Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
Yes, I promise.
By the authority vested in us by law and in conformity with the decision of the committee here present, I hereby confer upon you, Stephanie May Ashton, the degree of doctor and grant you all rights attached by custom and law. As evidence of this, I now present you, or in a minute, present you with the degree certificate signed by the rector, the secretary and the other members of the committee and affixed with the official seal of the university. Okay. Dear Stephanie, dear Dr. Ashton, it's my pleasure to be the first to congratulate you on this great achievement. So congratulations, Dr. Ashton. I'm going to keep it short, by the way. First of all, I would like to say that I felt very honored when Connie and you asked me to become part of your team and take up the role of promoter. You didn't really need me, I think. I was more of a necessity to have, but I hope you at least learned a little bit from me over the past years. And over those years, I in any case learned some things about you. For example, you're extremely passionate about your work, you work hard, and you have so many ideas for future research. I admire you for that. I wish, though, that I had counted how often you said, yes, but, to Connie and me, whenever we had ideas or maybe shared our potentially useful experience in how you could also do your work. You have this typical stubbornness and sometimes had trouble accepting our views. But hey, who cares? You have the degree now. And it's part of who you are, and certainly sometimes you also proved us wrong. Anyways, in your future career, keep up this good scientific spirit, and you will come a long way, I think. I would like to give the word to Connie now, because she knows you much better than I do, and I know she has a lot about you to say, but also to say a lot to you. So congratulations again on this very nice achievement.
This is not waterproof, by the way.
Oh, that's right. Dear Dr. Staff, I'm also proud to be one of the first to address you actually as Dr. Staff. And we have been incredibly fortunate to have you with us. From the very beginning, you had displayed remarkable independence and possessed the perfect critical eye that a scientist needs. Speaking of that first meeting, we go back to 2019. I vividly recall that meeting. Your enthusiasm for the topic stress and trauma was sparked during the course of Professor Tom Smeets as part of your research master in psychopathology. You sought out for internships and you approached Tom. And he, with his talent to recognize potential, brought you to my attention. At that just moment, I began a new research line into stress and motivated forgetting, and your fresh psychopathology perspective was more than welcome. We discussed the ideas, the projects, and you told me that you were interested, though you wanted to travel first. So the start of the internship had to be postponed. Traveling is your passion, and it's also a passion that you share with your partner, Eric. Who would have thought that meeting a Dutch guy in a cafe in Bali would not only result in finding your rock and anchor in Eric, but also in his valuable contributions to your thesis, particularly the programming part. Upon your return of the travel, we started our first project together. Instantly, I think, forming a cohesive team. You brought your psychopathology angle to the project by focusing on intrusions. During the first project meeting, you asked questions about the ethical approval. Not because we didn't have the approval yet, but because, as you said, I'm quoting, I just want to know these things for if I have to do it by my own. You had already clearly in mind that you wanted to continue in research after your master's. And I think this exemplifies something of you. It defines you. You have, most of the time, your goal clearly in mind. Whether this is the target date for completing your project or for purchasing a boat. You had that also already quite long in mind. Soon, your organizational skills emerge as a standout talent. Your talent for recruiting and scheduling participants was not something short of masterful. For instance, your initiative during the introduction week for the first year psychology students. To get participants, Stephanie flyered during the first bachelor introduction week, and she told them, well, you don't know yet, but you need to get credits, and I have a study in which you can get quite some credits, so come and participate in our study. So that's how she finds motivated participants. And this is also how you are ahead of a lot of people. Comes more. Yeah. So you managed to recruit 180 participants also during COVID times. In total, you tested 516 participants across experimental chapters 2 and 5, which were multiple day studies most of the time, so you have seen way more participants. On top of this, you also collected and analyzed data of 501 participants in this mega-analysis that is presented in chapter 6. I think you not only contributed to science, and specifically the field of memory, by these well-powered studies. The registered report, also presented in chapter 5, also contributes to this elimination of selective reporting and publication bias. These are your work manners. And you also shared the data on public reports, repositories, and you also have open access publications. And in that way, I also really think that you are an example for many colleagues. And you did all this work, really a huge amount of participants in COVID times, with a much higher teaching load than the other PhD students normally have. Though I'm not sure whether I should call it teaching load, because you really enjoy teaching, and maybe that is because it's in your DNA. Your teaching and supervision skills are appreciated by the students. And this is evidenced by exceptionally high tutor grades, but also by winning this tutor prize, which not a lot of people do. But it's also exemplified by the evaluations from the students. They describe you as very friendly, funny, and clear in communication, and very skilled at dealing with difficult subjects. For example, subjects who were lying during our screening procedure and had to be excluded. They also told me that your leadership shaped them as a researcher. You also supervised a lot of research projects for undergraduate bachelor students, these marble projects. And you were generally engaged in these projects and would always join their end symposium where they present their results. Of note, you were also the last one who was leaving the event after where they got the drinks. As said, there are family ties to education. Your mom is an English teacher, and you regularly asked her whether our feedback regarding the English in the paper was correct. It turned out that we sometimes weren't, and you would then politely reply to our comment in the document, "I checked with my mom, and it's correct like this." I also think you got another talent of your mom, graphical design. The figures in the chapter of the whole booklet really look beautiful, just like the cover of your thesis, designed by your mom, right? And speaking of books, the two of you and your mom, are actually collaborating and are writing together, or trying to write together, a children's book, combining your expertise and passion. And I think it's hard to imagine a more delightful project than that. For your PhD, each project has been a result of collaborative effort with researchers nationally and internationally, and it has been performed most efficiently. And yes, sometimes the book was too slow, so we had our own book. And I think that from the very first beginning, we were at the same page of that book. I admire your dedication and loyalty to colleagues. Steph not only managed to test all these participants, she also tested them, for example, in weekends. And she does that also for projects of colleagues of our department, also at the moment. You are in general very helpful, whether it's in explaining how to measure EEG, learn students to induce stress, or Photoshop one of your parents into a roller coaster for a birthday gift. You do it all. You also helped me with writing of multiple grant proposals, which I really appreciated. Though you do know to prioritize, and your kind of alter ego, Sophie, can be also very unhelpful, which is a good thing. You grow as an independent researcher, and you overcame some initial insecurities, which are normal when you start something new. I think, for instance, about the EEG analysis. There were some doubts at the start, but also this was your perfect project for procrastination. Though your procrastination was a bit nerdy. You started to program, and also you became proficient in it. And I think your ability to turn these challenges into opportunity for growth is a testament of your resilience. I also still remember how happy you were when you finally became office mates with your two parents. Your friendship with these two lovely office mates, symbolized by the 3 witches pictured on your doors, has undoubtedly been a source of strength and support through this PhD journey. They have supported you on all levels, directly by helping to translate a summary into Dutch, but also indirectly by doing a lot of fun things together. For instance, playing padel or killing zombies in VR. And it turns out that you are even amazing in that. You can kill them and dance at once. They didn't tell me how long I was allowed to speak. Just so you know, I'm always done. Though, playing padel highlights another aspect of your character. Your occasional clumsiness. I think you agree, right?
I will agree, yeah.
So, to give some examples, you did hurt yourself when you played padel just before you turned 30 and you threw a big party. Or if I remember correctly, a phone that you would have, it never lasts longer than 1 year before it gets damaged. And losing things, well, I can have a whole list, but losing car keys, losing a bracelet that you need for a conference dinner, it all happens to you. Though you're also master in finding solutions to these things. And you're very convincing to people to get them done what you want to do. Just like you did at the 5-star hotel when we got our port tonic for free in a different restaurant than they had officially said. Unfortunately, the most of your PhD was during COVID times, and so you were not able to visit many conferences. Still, you were always came back inspired, and you have really that ability to transfer what you hear there, your ideas, into new studies. While for all of us COVID was challenging, it was even more for you. You like to have people around you, and you could not celebrate, for example, Christmas with your parents back home, or Boxing Day in a cafe with your friends. Still, it also had a silver lining, something I learned from you, because during COVID, you got your rabbit Nugget. And yes, people, he is the most spoiled rabbit I've ever seen. I saw Stephanie once preparing lunch for him, and he only gets really the best fresh vegetables that are there. It's true. It's true. It's also interesting, since you always buy these Mensa sandwiches for lunch that you often don't like, but you still keep on buying them. Anyway, the love and care for Nugget also exemplifies your caring nature in general. And although there is distance, you will always be there if your number one fan, your Nan, would need your help. Your Nan holds immense significance for you, and between the two of you, there is a genuine exchange of care and support, even literally when you board her walker for a Halloween party with your friends. And let's not forget the love for Manchester United. You and your dad, Andrew, are huge fans, and you get quite frustrated when they lose. Though we both know they should now have the best coach that's there. Let's see. Being a football fan is also one of the many things that we share. We talked about it a lot, either with a nice glass of wine or when you had a coffee with the coffee princess. Our shared interests also bond us beyond academia. And I admire your approach, how you approach life with a sense of balance, finding joy both in work and leisure. And now that we embark to the next chapter together, you as a postdoc for the next 3.5 years at the forensic department, together with Melanie Sauerland, I look forward to more fruitful collaborations and cherished moments. Dr. Staff, congratulations on this remarkable achievement. Eric, you have been the thinking hat for Staff, and I also want to thank you and congratulate you, the family-in-law, your mom, your dad, and also the people online with this amazing achievement. I would like to end with a quote of your dad, after he had visited the lab in Maastricht, and you prepared a cap on him, an EG cap. He said, "Steph, you are a proper scientist." And indeed, you are, and we are proud of you.
So, dear Dr. Ashton, also on behalf of the Faculty of Psychology and Neuroscience, I would like to congratulate you. It's good to hear that you will stay with us for a couple of years as a postdoc, and you will be going to this section of forensic psychology. And it's kind of interesting because you and your data and your beliefs on suppressed memories, you will encounter a lot of new colleagues that would claim that suppressed or repressed memories absolutely do not exist. So I wish you a lot of luck in the future with these memories wars. This brings us almost to the end of the ceremony. I would like to thank all of the members of the committee for being present and their contributions. It's almost time for a party, I think, that is supposed to start at 3 o'clock for the audience in Café Zuid. Before we arrive there, or before Stephanie will arrive there, the committee will gather in front of the stairs to make a picture of this memorable day and moment. And with that, I finish this session. Thank you very much.
Recording stopped.